Meanwhile, 25 minutes before the top of the hour, the president's massive health care reform law will not only cost taxpayers billions of dollars, it may also cost Americans jobs. But White House advisor Valerie Jarrett doesn't seem to think that's going to be a problem.
What they are going to have to write off is nothing compared to the enormous financial benefits to those very same companies by health insurance reform. We're taking a number of measures that will dramatically reduce the cost of business. So on balance, business will come out way ahead.
Business will come out way ahead. Really? Well, let's talk to two guests up in Boston. Joining us right now, Richard Packer, the chairman and CEO of Zoll Medical Corporation, which manufactures heart defibrillators. And the guy screen left, familiar to many people, Massachusetts Senator Scott Brown. Good morning to both of you.
Good morning. Good morning, Steve.
Senator, let's start out with you. Valerie Jarrett over the weekend said that ultimately businesses are going to come out way ahead. Do you agree with that?
No, I don't. Anytime you're going to raise taxes on businesses, especially what we're talking about today, medical device companies in Massachusetts, we're going to lose jobs. And while it's easy to talk about all the good things, which many of us agree with, they're not talking about reality, about the things that are really going to hurt businesses and jobs in Massachusetts and throughout the country. And I think they need to start focusing on fixing what's wrong with this bill.
Well, let's talk to Richard, because he runs a big medical device corporation, Zoll. Richard, you've taken a look at this new tax that the president's health care reform bill is going to place on your devices, and in particular on your company. What kind of numbers are we talking about? How hard is it going to hit you?
So it's pretty scary, Steve. Our fair share of this tax on this year's revenue would be about $7.5 million. To put that in context, our company last year, for all of last year, only made about $9.5 million.
Well, there
so
goes
it essentially
that.
moves our company to a break-even position.
Well, for the people who are going to have to pay those taxes on the devices, they're wheeling a bear in here. That's a noise. It's a variety news show. For the people who have to actually pay for that stuff, Richard, how much is it per device?
So on a $10,000 device, it's going to be $250, $300. Some of the less expensive devices, like you would see on the wall of your studio, hopefully, in AED, it would be about $40 or $50 if we're able to pass it through.
And Senator Brown, what that means is ultimately they pass it on to all of us, or for the businesses, like Richard's business, they're going to wind up having to perhaps lay people off or not hire people in the future.
Well, actually, that's true. When I was running, I actually visited Zoll Corporation and was very impressed by what they do, certainly. But they made it very clear that if this tax passes, it'll put a lot of people out of work or put them at a competitive disadvantage. And as I said, there are many things that people like about this bill. But the president and the administration, as they're taking the victory lap, they're not talking about the bad things. They're not talking about the reduction in Medicare. They're not talking about the increase in taxes. The medical device company tax is another example. There are just so many things that need to be looked at and spoken about in plain English and try to solve the very real problems with this bill. Our businesses and people are going to be hurting for many years to come.
Yeah, and in fact, Senator, you sponsored a motion to kill the medical device tax. But ultimately it was voted down. That's got to be disappointing.
Well, it's unfortunate because, once again, if we're going to have a bill, and it appears that obviously we do, then let's make it a good one. Because right now, the medical device company tax is one example. There are a whole host of other tax increases and cost increases. And, I've asked the president and the administration and all the people that are pushing this, to do it better. Let's do it right. Let's do it better. And stop taking the victory laps. Stop with the rhetoric. And let's just get back down to business.
Yeah. Richard, how many jobs do you think this is going to cost your company?
It's really hard to say, Steve. Hopefully none. I mean, we are a very resilient and hardworking company, and that's obviously our last choice. But at the very least, it's going to mean fewer jobs that we can create. So it is a major problem for us.
Well, this morning on another network, President Obama was on, and he had this to say about the brouhaha over health care reform.
This is what happened. in Washington when you have a big debate. Suddenly the passage of this bill is Armageddon. And as I pointed out, the next day after I signed it, I looked around and no asteroids had hit the planet and no cracks had appeared in the earth. This is a bill that is going to help a lot of people and help to lower costs of health care, but it's not a radical departure from what we've done in the past.
Well, there you've got the President of the United States recycling a joke he made a couple of days ago about Armageddon. Senator Brown, do you think that's funny?
No, I think the rhetoric needs to stop, and the president needs to get back to basics and look at this bill with open eyes and fix the things that are wrong with it. Because right now, as you heard from Richard and many other companies, they're going to be hurting. Seniors are going to be hurting. A lot of parts of this bill are going to increase taxes. And what about doctors? Do we have the doctors in play that are going to provide all these services for people? So we need to start talking about Armageddon and all that stuff, and really stop being cute and start to focus on solving the real problems with this bill. I know,
Senator, you were going to take a tour of Richard's facility today, but because of the flooding, you're not going to be able to do that, right?
Well, I've taken the tour. It's a great facility. I encourage others to do. I encourage the president to come down and take a tour. But yes, we're going to be going out and obviously seeing what we can do to help people in Massachusetts with this flood and make sure they get the funds and resources, individuals and businesses, to get back on their feet.
Right. I know you were going to have a press event there later on today, but that's been scuttled. And one more thing, Senator, before you go. I know that when you were campaigning in Massachusetts, you were campaigning as I will be the 41st vote against health care. Ultimately, you were not able to stop it. How do you feel about that?
Well, I'm the 41st vote still on a whole host of other things. Financial reform, we're talking about illegal immigration, anything. What they did is, obviously, they did everything they could to ram this thing through against the will of the people. And, that's a result of my election. Otherwise, they would have had a more onerous bill. But they had to deal with what they were given because I got there. And I'm very excited to continue to solve the problems and be the independent voter and thinker I've always been, regardless of numbers. Sometimes I'm going to be the 60th vote. Other times I'm going to be the 41st vote. So we'll see what happens on each and every bill. I'm going to look at it independently.
All right. Brand new Senator Scott Brown, we thank you very much for joining us from the Boston area, along with Richard Packard, the CEO of Zoll Medical Corporation. Guys, thank you very much.
Thanks, Steve.